All right. Welcome everyone, and thank you so much for joining us this morning. We're really excited about this forum and about getting stuck into some of the detail of the soon to commence Mental Health and Wellbeing Act 2022. We will also be going through a consultative discussion about some of the work that MHV is planning to do to assist you all in the community and non-acute sectors with transitioning to the new legislation. And I'm thrilled to have Taylor, our Mental Health and Wellbeing Act Project Implementation Coordinator, slightly too long a title, I should have thought about that more, who's joining us for that section of the day as well. We are just about to hit 10, and I did ask everyone to be promptly online for that so we don't waste any more of our Deputy Secretary's time. But I will just give it another minute to allow people to join us, and then I'll start with introductions and we'll get stuck into it. All right, well, in the interest of keeping it nice and tight to time, I'm going to get us kicked off. Welcome everyone. I would of course like to acknowledge the traditional owners of the lands on which we are meeting today. I extend my great respects to the lands on which each of you are today, but in my case, we're on the Bunurong, Boonwurrung and Wurundjeri Woiwurrung lands of the people of the Eastern Kulin Nation. I'd like to pay my respects to elders past, present and emerging, and acknowledge that sovereignty was never ceded. It always was and always will be Aboriginal land. I think it's fair to say that we're on the precipice of some very significant decisions here in Australia and in Victoria, with treaty negotiations underway at a state level and of course the upcoming voice referendum. I will personally be proudly voting yes and be out encouraging everyone I know to vote the same. It's an important time for us all to consider how we better amplify First Nations voices and issues and decolonise our own spaces to make them culturally safe and accessible. I'd also, of course, like to acknowledge those of us here today on the call touched directly and indirectly by mental health vulnerabilities, trauma, suicide and neurodiversity, as well as their families and kin, friends and carers. And I'd like to acknowledge the ongoing contribution of these people to our sector. It's a very brave and generous thing to share some of the most vulnerable parts of yourself. So to do so in pursuit of a better system, to ensure that those who come after you have a more compassionate experience, is a wonderful thing. And of course, we can never underestimate the value of this sort of wisdom. Just to get through a few housekeeping matters, as you've probably all seen, as you've joined us on the call today, we are recording this session and we intend to make the recording publicly available as an ongoing educational resource, but also to supplement for those who are unable to attend this morning. As I mentioned in our pre-forum materials, if you don't wish to feature on the recording, we ask that you don't elect to make a spoken contribution during the consultation portion of the day, and instead use the chat function or even private email to pass on your input so that you're not recorded. We'll be using slides for all three of our presentations this morning. So for those whose Zoom skills might be a little rusty, which was absolutely me until I run through yesterday, I just thought I'd mention that if you'd like to view the presentation and the speaker together, you can select the view button at the top of your screen and select the side-by-side speaker mode option, which will give you the right setup so that you're not missing out on any of the detail. And speaking of the chat function, I'll just mention that this will be monitored by MHV staff throughout the forum. So please act with decorum, don't make me go in there. But we will use that much more when we get to the collaborative session, and I'll be working with Taylor to help her identify questions, answers and suggestions for discussion. And in that time, we may call on individuals to either ask their question aloud or elaborate further on their point. And if you don't wish to be called upon, please let us know, we won't do so. So moving on to the first item for the day, we are of course thrilled to welcome Catherine Wetton, the Deputy Secretary for Mental Health and Wellbeing Division at the Department of Health. I might add, soon to be Chief Officer for Mental Health and Wellbeing, one of the many exciting new changes coming in the Act. Now, Catherine needs no introduction to most of you, but I will mildly embarrass her with her own professional accomplishments nonetheless. Catherine became our first ever Deputy Secretary for Mental Health and Wellbeing in January 2021, just shortly before the release of the Royal Commission's final report. Lured, I can only assume, by the mammoth task that it represented and an opportunity to make an indelible mark on the mental health landscape of Victoria. She had previously been a Deputy Secretary in the Department of Education and Training, and before that occupied several key roles in DPC. Clearly a consummate public sector leader, we are so appreciative that she's made herself available this morning to take us through this presentation. So with no further ado, I will hand over to Catherine, and she's going to take us through her presentation, 5 reasons why you should be excited about the Mental Health and Wellbeing Act 2022. Over to you, Catherine.
Thank you, Emma. That was embarrassing. Good morning to everyone. Can I just double check everyone can hear me? Great. Yeah, it's really lovely to be here today, and what a moment in time in the mental health and wellbeing reform agenda. I would also like to acknowledge that we're meeting on Aboriginal land, and for me that's the Wurundjeri people of the Kulin Nation, and I pay my deep and sincere respects to elders past and present. Really like to extend that respect to any Aboriginal or Torres Strait Islander people joining the forum today. I would also really like to welcome people with lived and living experience who are part of today's meeting and so many of the pieces of work that we're doing. Thank you for working in partnership to achieve system transformation. And as Emma was saying too, just thank you so much for sharing so courageously and generously your stories so that we can work towards a better mental health and wellbeing system. So, as everyone knows, from 1 September this year, Victoria will have a new Mental Health and Wellbeing Act. The new Act replaces the Mental Health Act of 2014, and it responds to a really important recommendation made by the Royal Commission into Victoria's mental health system. The new Act supports the changes that are underway to transform the mental health system and to deliver a system where Victorians receive the care they need, and that it's early and in their community, close to their networks and their families. And fundamentally, this new contemporary Mental Health and Wellbeing Act reflects a compassionate Victoria. So you can see here, it leads to the topic for today, the 5 reasons why I think we should all be excited by the new Act. And you can see on this slide here, we've listed the top 5 reasons, and they are that the Act reflects the broad end-to-end service system envisaged by the Royal Commission. So it's really about putting aspiration of the Royal Commission into practice. It places people with lived and living experience of mental illness and psychological distress at the centre of the system. Its objectives reflect the Royal Commission's aspirational vision for the system, and it has enhanced rights-based principles and new safeguards. Now, having listed those, I'm going to spend a few minutes expanding on them. So we'll move into the first one. So the new Act reflects a broad and more inclusive end-to-end service system that was envisaged by the Royal Commission. And as we know from the Royal Commission, a really big focus on mental health and wellbeing promotion, prevention of mental illness, early intervention, and far more community-based services. And it does this by bringing a range of mental health and wellbeing services within the scope of mental health legislation for the first time. Now, this means that both there's the aspiration, but also there are obligations in relation to mental health and wellbeing principles. There are duties about quality and safety of the services, obligations related to communication, consent, and information sharing. Now, the new Act also establishes new governance structures, and that includes things like the new Mental Health and Wellbeing Commission that will include the existing complaints function, but also really about elevating lived experience leadership and holding government to account for the progress that's made on the Royal Commission's recommendations and implementation. Another set of governance structures that are established are the regional mental health and wellbeing boards, and these are going to really help us look at what services are needed in a better connected system and at a local level to better serve communities. The Act will also see some additional services come within the jurisdiction of the Chief Psychiatrist as well. So if we go to our next slide, to talk about lived and living experience. So the Act changes the focus from the current legislation so that the mental health legislation positions people with lived experience of mental illness and psychological distress, their families, carers and supporters at the centre of the system. Now, this is embedded in the mental health and wellbeing principles with the lived experience principle. Now, I won't read the detail, but essentially it means that lived experience is to be recognised and valued. The Act supports the inclusion of people with lived and living experience in senior leadership roles across the system. Now, this includes leadership positions across the new entities established by the Act with guaranteed representation of people with lived experience as a consumer or a carer on the governance bodies of, so the Mental Health and Wellbeing Commission that I just mentioned, the Regional Mental Health and Wellbeing Boards, Forensic Care, Victorian Collaborative Centre, and in the case of the new body, Youth Mental Health and Wellbeing Victoria, young people with lived experience. If we move to the objectives of the new Act, so the Act's objectives reflect the Royal Commission's aspiration for the new mental health and wellbeing system. And the primary or overarching objective is to support the highest attainable standard of mental health and wellbeing for Victorians. Now, these are system level aspirations that do come with some new obligations for mental health and wellbeing services. The objectives aim to support delivery of comprehensive, compassionate, safe and high quality services that recognise and respond to the diverse needs of people who use them. Now, this is in a system that connects people with other support services that respond to their needs, which can include alcohol and other drug support services and treatment. There's an obligation to include a broad range of treatment with the aim of providing access to the same treatment and support, irrespective of whether a person is receiving voluntary or compulsory treatment. And this is about supporting people to get the care they need without being on an order. And if they are on an order, ensuring they can still access holistic care. Now onto the principles. So the Act's strengthened rights-based principles provide the foundation for compassionate treatment, care and support in the system. Now there are 3 sets of principles across the Act. They relate to decision-making principles for treatment and interventions, information sharing principles, and mental health and wellbeing principles. And to stick with that, there are 13 mental health and wellbeing principles. And I think they really are the key to driving the practice and culture change that was envisaged by the Royal Commission and better experiences of the mental health and wellbeing system for everyone, including, very importantly, members of the workforce. Now, the principles seek to guide service providers and decision makers to support the dignity and autonomy of people living with mental illness and psychological distress. They seek to ensure people are involved in decisions about their treatment, care and support. They recognise the role of families, carers and supporters, and they ensure that the service system is really going to respond to the diverse needs of Victorians. Now, under the Act, mental health and wellbeing services must make all reasonable efforts to comply with the mental health and wellbeing principles when exercising a function under the Act. They must also give proper consideration to the principles when making a decision, and there's some additional requirements that about annual reporting there as well. Now, recognise there's a lot of information to take in, and for some of you, some of this won't be new. I know there's been lots of work already to prepare for the new Act, but I do really want to assure you the department is working with our sector partners and workforce representatives and excellent organisations like Mental Health Victoria on a range of resources to help the workforce translate these principles into practice. Now, to talk about the new safeguards. So the Act includes new safeguards to protect people's rights. And this is where community-based services do have a really important role to play here, working to support people who may be at risk of compulsory treatment and to think about whether they want to exercise these rights. It speaks to the supported decision-making principle, supporting people to have safeguards in place ahead of time in case they're needed. So the key parts of the Act include a broader range of preferences relating to treatment, care and needs can be included in a statement of rights. The Act clarifies the role of nominated support persons, and it does relax the witnessing requirements to really try and support increased uptake of that. And there are obligations to provide appropriate support to people to understand and participate in decisions about their treatment, care and support. Consumers have to be provided with written reasons when a treatment preference outlined in an advance statement is overridden or a second psychiatric opinion is not adopted. There's also a new opt-out non-legal advocacy service that will support individuals to make or participate in decisions so that services are responsive to an individual's needs and preferences. And information about a person must not be disclosed if there is a risk that a person may be subjected to family violence or other serious harm. And also, carers in their own right can make a complaint to the Mental Health and Wellbeing Commission if a service fails to comply with the principles. So just wrapping up today, I'll just touch on a few of the pieces of work that are underway to support implementation of the new Act. So we're partnering with a number of peak organisations, including Mental Health Victoria. So really great to have today's session. This is really about trying to support the community and the mental health and wellbeing sector to understand the new legislation. We're also developing an e-learn training package for the workforce, and Taylor will go into this in a bit more detail on how it will work in her presentation shortly. We have ACT implementation leads employed in designated mental health services to support the transition to the Act, and having met a few people who are in those roles, are very passionate about making this work, which is just fantastic to see. I mentioned earlier too, we are developing guidance, training and resources to help services and members of the workforce understand the changes in the new Act and what they will mean in practice on the ground. We've also got a big project underway to revamp the content of the health.vic website, and there'll be a new Act handbook that will make information easier to find, and we're really trying to make it more accessible and engaging. We're also consulting with representatives of Victoria's diverse communities to better understand the sorts of resources and supports that they need to communicate about the new Act. And you can see on the slide here, I've included some links that have some further information about the Act, and also there's an email address if you'd like to sign up to receive our regular sector bulletin that has information and updates about mental health and wellbeing reform. So we're really grateful for the work that our sector partners are undertaking, and I'd particularly like to thank Mental Health Victoria and Emma for the work that is underway to support the sector. Really appreciate the opportunity today to present, and I do think there are genuinely some really great reasons to be excited about the new legislation. Might be a little bit daunting given that it's coming and it is soon, but just how much it really can reflect that aspiration for a transformed mental health and wellbeing system to better support Victorians. So really looking forward to our continued work. Thanks again for the opportunity today, and Emma, I'll hand back to you. Thanks.
Fantastic. Thank you so much, Catherine. It's really special not only to have a brand new Mental Health and Wellbeing Act that resets the legislative foundations we're working with, but to have yourself make that time to come and speak to us about it is really meaningful. And we thank you. We recognise that you've got 1,000,001 other things to be getting on with. So we're going to move into the next few parts of our agenda, and you're very welcome to jump off and get back to your work. We've got many members of the department here joining us, and so I'm sure they'll be able to give you the summary of what we got up to after the event. Thank you, Catherine. Well, thanks everyone. I hope that was a helpful introduction to the discussion that we're going to have shortly, led by Taylor. Now, unfortunately, I do have some bad news, which is that our dear Kaz Coleman has not been well enough to join us today. The poor thing's been battling another bout of COVID. I'm sure many of us here know what that feels like. And so in her stead, I'm going to run through a little bit of detail for you about the amending bill just now. However, one of the things that Kaz has been working on is a written summary of the various clauses in the amending bill so that we can circulate that to people and you can have a bit of information. So just for the context, for those who might not be across this aspect, an amending bill was introduced to Parliament in the last sitting week before we hit winter break. It was relatively short and sweet. It is largely about providing clarity on issues that were originally set down in the Mental Health and Wellbeing Act last year when that passed Parliament, as well as making some minor changes to align with the situation within the sector, like a more updated approach to what is feasible and what is possible within our resourcing. So for the most part, it's relatively minor. It did pass the lower house with a reason amendment from the opposition, which indicates that there could be some amendments being mooted when it is remitted up to the Legislative Council. So we'll be watching that closely when Parliament resumes, which is August. But we just thought for today, we'd give you a bit of a brief summary of what's in there. And of course, we will briefly touch on the part you might have seen in the media, online, in the news, which is to do with the health-led response and changes that the government's made in that regard. Go to the next slide. So I just wanted to run through that there are some great improvements in the amending bill that builds on the solid work that was done by the Mental Health and Wellbeing Act last year. For example, there are amendments to sections relating to the application of ECT to be more rights specific and to recognise the principle of least restrictive intervention and least restrictive approach to care. We also have clarifications around information on care and control matters granted to a young person's parents, carers and supporters in addition to the person themselves, where that's appropriate. There's also an 18-month extension for establishment of the regional boards. That's largely just to enable for those interim regional bodies to mature a little bit more and for the department to bed down its processes before commissioning powers are granted and the boards themselves are established, largely uncontroversial. Of course, there's affirmation of mental health advocates acting for a patient in a review of an intensive monitored supervision order on the instruction of the patient. Again, it's not that that wasn't the intention initially when that was passed last year, but that with the passage of time and with practical inputs about how that would work, the point was made that we should really very clearly lay out in legislation that those advocates act only for the patient in the review on the instruction of the patient and are not there to represent the views of others or the service or anything like that, making sure it's nice and clear. Now this is a technical space where I will be out of my depth without Kaz here, so I'll be relying on sending some more details out to everyone on this, but essentially adjustments to the Judicial Proceedings Reports Act, reflecting the Royal Commission's view for stronger relationships between complaint and regulatory bodies. So that is a component of the amending bill that will go to another piece of legislation, not the Mental Health and Wellbeing Act, but they're very closely related on those matters. Fantastically, there's a very, very clear mandate for the functions of youth mental health and wellbeing, a newly created agency under the Act last year that is coming into effect again with everything else on the 1st of September, very much clearly about the role for Youth Mental Health and Wellbeing Victoria to uplift and spotlight the voices of young Victorians in the design and implementation of the service.
My apologies. It's
my computer just glitched out and completely dropped. I'm so sorry, everyone. I'm not sure what I was up to. Sorry, remind me, Alex. Aha, the amending. Yes, here we go. All right. Sorry about that, guys. Technical problems. Inevitable with these things, isn't it? Yes, so we've got here reference changes to ensure that the whole Mental Health and Wellbeing Commission has authority to conduct the work of the Commission, not just the appointed Commissioner. So again, that's just a clarification matter as the work was being done to kind of get through the practicalities. There was so much in that bill and in the bill that became the Act. It was 700 odd pages. So there is a little bit of tidying up being done in time for commencement day. Next one. So I will just very briefly touch on the matter that is probably front of people's minds, which is the health-led response. So certainly this is the item that captured the attention of the opposition when it was being debated in the lower house, and that we expect will be the subject of potential amendments or discussion when it reaches the upper house. So for context sake, recommendation 10 of the Royal Commission's final report provides that where possible, mental health crises should always be responded to as a health crisis, not a law enforcement matter. And essentially the long and the short of it is that we should move away from the current model where there's a mental health crisis out in the community, someone's not well, been identified by another member of the public, acting erratically, needs help. At present, the way that's responded to through 000 calls at ESTA is to deploy police or potentially PSOs if they're in the area. So that has been the way these issues have been dealt with for many years. Very rightly, the Royal Commission recognised that that is not conducive to recovery outcomes for people experiencing acute mental health crises, and that mental health is a health issue, should be treated as such. I think we would all agree. It's not a controversial statement and it's a long overdue transition. In order for that to happen, there are a few preliminary matters that have to be attended to. Think back, you need to have new protocols for ESTA to know how to direct calls. There will be a very small number of mental health crises where we may send both paramedics and police if there's a risk of violence to people in the area. But paramedics will have the leading role even in that situation. Nonetheless, we need to be able to provide that clarification to ESTA so they know how to operate. We need to make sure that we have paramedics who are trained in de-escalating mental health matters and in safely and securely transporting somebody if they need an assessment. We need to have arrangements between police and paramedics about how they act when maybe there's not been a 000 call, but police themselves have come across somebody in distress. So there are a lot of practical matters that need to be dealt with. And ambitiously, last year, the Mental Health and Wellbeing Act made the changes to put paramedics into the suitable class of people that are able to use care and control powers in anticipation of this transition. However, in the last, less than 12 months, as that work has been proceeding, what became evident to the government, as we understand it, is that the 1st of September this year would be too premature to enable that full transition, and that in fact having paramedics be prescribed in the Act like that, so defined, would put great legal risk and frankly practical risk on classes of paramedics who are not yet trained in how to manage that situation. So the government made a decision to pull back from what was going to be commenced on the 1st of September. To be very clear, it is the law as it stands today, the 20th of July, is still that police lead crisis responses. What we will be moving to is paramedics, but we are just going to change that from being expressly prescribed in the Act. It's now going to be available to be prescribed in regulations at a later date. You've got there the 2 clauses that are relevant in the amending bill that go to the broader Act. That's just to give you that explanation understanding. One other point that I think is relevant for context's sake is that the time frame prescribed by the Royal Commission for delivery of a health-led response is actually end 2024. So in terms of our collective duty to hold government to account on delivery of the Royal Commission recommendations, this change will not prevent us from being able to do that and from ensuring that the Royal Commission recommendations are followed, because there's now 18 more months between now and the point where that transition is required. I think it's fair to say that with a giant report such as we received in March 2021, 74 recommendations total, 220 odd sub-recommendations, some of the sequencing may not always be right. And I think it's a good move for a government to be responsive to the challenges that are facing and the practical realities of the system. That is not to say that there is nothing more the government could do to give effect to more health-led responses in emergency situations. And indeed, we will be looking closely at what other recommendations MHV can make to government about other mechanisms still available to make sure that we're moving in that direction. And we want to be really keeping a close eye on the next 18 months to make sure that we are meeting those deadlines for a transition to a health-led response. But it is not our concern that this particular amendment will prevent that being possible. So we are not sort of alarmed at this point. It is a practical change that's been required in order for AV to have the work that they need to do be completed. We just wanted everyone to have that additional context, and very happy to take further questions that you might have on this, We're going to take all technical questions today on notice because we're just not in a position to get into the nitty-gritty of the detail, and we wouldn't want to be giving anyone information that wasn't absolutely technically legally correct. So if you do have questions about this aspect or any other aspect of the amending bill, I encourage you to throw them in the chat, email Taylor, email myself, whatever you would prefer. And we are going to do a kind of roundup of everyone's queries as a result of today's forum and provide some written answers to those questions so that everyone's got the right information and is operating from the same stuff. So sorry guys, I did get into the detail a little bit there, but I just think it's a space that a lot of people are asking questions about. We wanted to give you that opportunity to hear from our perspective of what the amending bill is seeking to do. As I said, it will be going in for debate likely the first week of August, but potentially the third week, which is when we next are in Parliament. And it is intended that if the bill passes, it will be brought into the Act itself and will also commence on the 1st of September. So these potential changes, if passed by Parliament, will then become law along with the whole Act on the 1st. Great. Well, that is my attempt to make sure that we've got that in the legal information. Again, sincere apologies that we couldn't have our expert Kaz joining us today. We hope that she feels much better very soon. What we will do now is move into a very exciting part of our day, which is the presentation from Taylor, who I'll introduce to you in just a moment, on the actions that MHV is taking to support the sector, particularly the community and non-acute sectors, in transitioning to the new Act. Taylor's going to run us through a short presentation, and then I will assist Taylor, and we're going to have a sort of facilitated discussion with you all about how we can better serve your needs, how we can make sure you've got all the information and advice relevant for the commencement of the Act, and basically what else we can do in the 12 months following commencement date to assist the sector in moving to this exciting new chapter. We are going to have that support for the first full 12 months, which is a phenomenal change on the transition to the 2014 Act, which was notoriously, I think we can all say, undercooked and did not provide ongoing assistance and supports to services in the first 12 months of implementation. So I'm thrilled that we have the wonderful Taylor joining us, and I'm going to ask her to commence her presentation.
Right, thank you for that, Emma, and hello everyone. Lovely to meet you all, and I'm very excited about this, to talk to you about this project today. So just for a bit of background, I am the project coordinator at Mental Health Victoria for the Mental Health and Wellbeing Act Community and Non-Acute Sector Implementation Project. Very lengthy title. One reason that I'm really excited to be a part of this is I started my mental health nursing journey at the start of 2014. So coming in fresh and was present for the last legislative transition. So do know firsthand some of the things that went really well and some of the things that potentially we have some room for improvement, particularly in the community and non-acute sector space. Now, as the system service delivery moves away from hospitals being the first contact point for mental health presentations, as it moves towards people being able to access mental health community services when and where they need it within their own communities, it means that the workforce itself does need to have that support to be able to then support that consumer and support the movement as a whole and to gain that accessible, holistic and person-centered care. So to tell you a little bit about this project, Mental Health Victoria did receive dedicated funding from the Department of Health to empower and support the community mental health and wellbeing sector through enhancing knowledge, providing training and support platforms to make sure that they are across the principles of the legislation and able to best uphold people's human rights. Arguably, the transition in 2014, there wasn't there was a little bit of room for improvement, particularly within the community space. So we are hoping to bridge that gap now and ensure that there is that whole collective knowledge amongst the community to better push forward the vision of the Royal Commission. So this project is to ensure a mutual understanding of the responsibilities and obligations under the Act and be able to direct the workforce as to where they might be able to get further supports if needed. So throughout this implementation, there are some supports that are being developed, so predominantly through the Department of Health. And the first one I'll speak to is about an e-learning package that is currently being developed. So this will consist of various modules outlining or highlighting particular aspects of the Mental Health and Wellbeing Act. Some of those modules will be applicable to all, and some may have ones that are more so relevant to their particular workforce needs. So looking at those, there are the first and primary e-learn module will be predominantly around why the legislation is changing, what our larger goal is, and what the guiding principles under the mental health and wellbeing legislation are. So I'm really excited for those to be available, and they will be readily available for anyone that's within the workforce. We do understand that given there is not much time until the legislation commences, as well as there are competing workforce issues and a whole lot of other training packages that community sector do have to do, there won't be an expectation that everyone has completed it by the 1st of September. There will be ongoing available, and as Emma said, this is the first time that we're having that prolonged support period for people in the workforce. The Department of Health is also developing a help desk. So this will consist of what are the likely frequently asked questions, and this will predominantly be coming from the workforce. So there has been large scoping activities done by both the Department of Health and Mental Health Victoria to gauge what your needs are, to proactively ask, what is it that you're going to want to know so we can be prepared to answer that for you going forward. So this will be online and available. There will be a knowledge library. People will be able to go through different aspects or themes that come up. And this will be, unfortunately, I don't have a date that this will be live, but it's something that the Department of Health are working tirelessly on at the moment. How MHV are going to support you in particular will be to ensure that we do have ongoing updates going through our own e-news platforms, but also through the relationships that we've forged with other organisations, including Royal Colleges, public health networks, other non-government organisations. We do want to make sure that as soon as we have the information, you have the information. To follow up on that, we will be endeavouring to explore having podcasts. So the vision of this would be potentially to portray all of the positives, all of the good news stories that have come from the new and improved mental health and wellbeing system, as well as ongoing webinars, including online Q&A forums. So particularly after the legislation has gone live, after the community have had time to sort of contextualise the legislation and see how it does apply to their work setting, we will we will host forums that will be able to provide you with that support in airing out those questions and deferring you to either providing the answers directly or deferring you to supports that can provide a concise answer for that. Thanks, Ellen. So how Mental Health Victoria has formulated our communication and action plan in regards to this project, we have really endeavoured to take a workforce needs-based approach in everything that we're doing. That's to say that we really wanted to ask people with boots on the ground, from everyone from graduate level to 30 years in experience to 50 years experience. We want to know what's working well and what doesn't, so that we can accommodate the training and support that is bespoke for you. So in doing that, we've done a few surveys, and I've seen some familiar names and faces that may have completed these surveys in the meeting today. So we've done surveys about what and how the workforce would like to receive information. What are the particular contention points in terms of knowledge gaps, perhaps, in the new coming legislation. We have tried to develop really extensive and collaborative relationships with the key organisations that are going to be affected in the community sector by this legislation. Because this new Mental Health and Wellbeing Act of 2022 does capture a whole new network of people in the workforce that haven't previously been captured. So that's not to say that everyone will have new and specific powers, but they will have that the expectation that they will be following the principles of the Mental Health and Wellbeing Act legislation. So the lived and living experience and peer support workforce is one of those new networks that's being incorporated that I'm very excited about. In developing our communications plan, it has been a non-negotiable, absolutely, that people with lived and living experience have definitely been consulted in regards to what works best for them. Because ultimately, the new Mental Health and Wellbeing Act is to serve the consumers, is to serve the people that are experiencing this distress and that it directly affects. So we have consulted heavily with Mental Health Victoria's Lived and Living Experience Advisory Group, as well as inviting all members of the community to put input. Thanks, Helen. So in terms of Mental Health Victoria's further plans, how we are going to keep you informed about the changes and updates with the Mental Health and Wellbeing Act. We will have ongoing collaboration with the Department of Health, so particularly within their help desk project and their e-learning module projects. We do give feedback and also do offer or have consultative groups through from various organisations to be able to inform the Department of Health's content a little bit more to make sure that it is bespoke to your needs. So we will have ongoing collaboration with them and really advocate for not only MHV's member organisations, but essentially the larger Victorian community. We will keep communications as transparent and as frequent as we can. So, and this includes updating boards, management, executives about Act compliance and making sure that that's on the radar for those. So some organisations, depending what aspect of the workforce that they are in, may be subject to Section 30 of the Mental Health and Wellbeing Act, which does dictate that there are certain obligations in following the mental health and wellbeing principles. We will be conducting regular check-ins with the community sector. So whether that be face-to-face, whether that be Q&A forums, whether that be wanting to hear all of your questions, queries, that will be something that we will be regularly engaging with. And this project does extend for, as Emma said, a whole year past the commencement of the Act. So we will be able to give that contemporaneous feedback to the sector. So as well as provision of Q&A questions, this one we are saving for once the Act has commenced, again, to make sure that people have had time to contextualise and really think about in what ways the Act is affecting their current work actions. One thing that I am really excited to announce as well is that Mental Health Victoria will be running a regional roadshow. Thanks, Alex. So we will be coming out and conducting community engagement. There are 4 key regions that we've decided to come out to specifically at the moment. So that being the Brimbank area, one day in Geelong and Ballarat, Latrobe and South Gippsland, and Benalla. So a lot of these areas have been chosen because of the initiatives that are coming up in their communities, some of those which are new, some of those which are very exciting, but it's also coming to regional areas has been a bit of a priority, because when it comes to community-based health, it does really fall into sort of rural and regional areas more so. That community aspect and that the collaboration, there does seem to be a lot more focus. So within these face-to-face engagement, it's an excellent opportunity for us to come and see firsthand the amazing work that the workforce are doing in the community. I think sometimes that there's not enough acknowledgement for the hard work that all of you are putting in to support consumers. So through this, we will be able to provide face-to-face sessions, giving information very similar to this around the legislation. It'll also provide communities opportunities to voice the concerns and the bespoke needs of their community, not naive to the fact that the needs of Geelong may be very different to the needs of Brimbank, that there will be certain demographic influences as well as staffing influences, and we want to hear those concerns to ensure that supports being given to the community are being heard and acknowledged. These forums will also provide opportunity for networking and providing those collaborative relationships within that community. There may be sectors where GPs, for example, GP clinics aren't quite aware of what the mental health and wellbeing locals in their area are doing, or what the referral process may be, or how they can work together to improve relationships and improve information sharing for their consumers. So will be a really good opportunity to bring all these, to bring you all together and be able to work towards achieving that ultimate goal of giving excellence in service delivery to our consumers. So other support mechanisms that are happening throughout the state. Mental Health Victoria are very privileged and very excited to be running these activities that we've got going at the moment. Sorry, I might just come back to Gail's question real quickly. Is there a time frame for the roadshows? So yes, the 4 regions that we've selected at the moment, dates are mildly tentative right now, but we do anticipate all of these roadshows will be conducted by the end of August. So you will be getting some communications from us really quite quickly, understanding that there is some of a short turnaround. However, we have really heard the anticipation and the excitement from the community sector in wanting to have that information sooner rather than later. So other departments, it's not just Mental Health Victoria that are driving these initiatives. Other departments have been supported by the Department of Health, and this includes Victoria Legal Aid, running their independent mental health advocacy and opt-out non-legal advocacy services. Tandem will be running their own resources to support carers and families through this shift. The VMIAC will also be developing or initiating things around statements of rights and advocating on consumers' behalf. MHLC and the Victorian Aboriginal Legal Service will also have their own projects in developing specific and targeted information for their cohorts. So there is a lot of work going on in this space at the moment, which I'm really excited, and they do sort of encompass all people that are affected by mental health. Now, we'd like to move on to a bit more of an open forum. So we've got a couple of people here that will be monitoring the chats for us, but I do want to throw to you guys as the workforce. We really want to hear some of your questions, concerns, so please put all of these responses through the chat where possible. I will do my best to answer all of your questions. I do want to preface that I am by no means no subject matter expert when it comes to the legislation. So there may be some things that I will have to say, I'm so sorry, I'm going to have to come back to you on that one, and we will be able to feed back all these responses to the questions. So to kick off, I'd really like to know from you, what are the components of the Act that you would like to know more about?
So if I can ask for this, if people would like to throw something in the chat in response, or if you'd like to actually speak up, then please feel free to, I think there's a raise your hand function, and I'll be able to introduce you to the group to be able to speak. We'd love to hear from the group about, the sticky issues, the parts of it that they feel, that you might feel you're not as well prepared for as you'd like, the parts that you find confusing. It's a big act, as I said, many, many pages, many exciting new changes, but that does mean that it can come with a degree of anxiety when organisations are doing their best to get across it. So is there any suggestions from the group about the components that you'd most like to have a deep dive on, or that you feel like would be good for a specific Q&A session that we could coordinate? Potentially, while we wait for people to submit any answers, I might ask Taylor to expand a bit on how are you capturing the primary care sector? Noting that, of course, community and non-acute is one part of it, but we've also got a swathe of GPs and primary care specialists in their own practices who are maybe not connected to a community mental health organisation. Do you have any plans that you'd like to share about how we're going to make sure that we inform our Victorian GPs about their obligations under the Act and the opportunity to be part of the new system?
Yes, of course. Thank you, Emma. So we have worked extensively. We're now developing really quite consolidative relationships with the Victorian PHNs. So not only individual PHNs, but also the Victorian Tasmanian PHN Alliance. So they have been incredibly supportive of us in terms of ensuring that, yes, they want the best for their GPs as well. So in terms of information sharing, more than happy to get across and support us in this endeavours, which has been fantastic and I'm very appreciative of. We've also been liaising extensively with the RACGP. So in terms of in what ways can they support us in conveying this information, as well as potentially discussing things like having those e-learn modules, having those contribute to CPD points for GPs to enhance the uptake, because ultimately that does achieve the goals of serving their consumers. So we've got really quite consolidative relationships there with the primary sector. There is propensity for the primary sector to feel a bit of a shift as things change, not necessarily because of legislative changes, but more so because of the service delivery framework changing. And as people should act moving away from hospitals, that means that GPs may have a little bit more contact with mental health than beforehand. So for an example of that particularly would be around crisis situations. So this includes where police or PSOs may apprehend someone under a Section 232. Instead of the default being to go to the hospital, the obligations will be to try and seek care for someone within their communities. So where available, that will hopefully be CAT teams. It may also be that if it's safe for the person and if it's safe for other persons, can they get that care with their local GP who has those trusting relationships and knows that person better to deliver that whole person-centred care. So there's some of the shifts that we may anticipate to see amongst the primary sector.
Fantastic. Thank you for that, Taylor. Now, I'm thrilled to say we're now cracking off in the chat so we can go into some of the submissions that we have here. Thank you, everyone, for joining. So actually, here's a great first question. Will MHV be collaborating with the interim regional boards?
Yes, and my CEO is nodding in the background there. Yes, absolutely. Mental Health Victoria has very strong intentions. We are currently collaborating with them and we do intend to continue to collaborate with them intensively. So from the contact that we've had with them so far, they have been very supportive in wanting to attend things like our roadshow forums, wanting to be behind getting momentum with our questionnaires and our surveys and be able to put as much input in as possible to support us. So we want to hear from them as much as they want to hear from us at the moment, which has been fantastic. And I couldn't thank them enough for their enthusiasm that they've shown us so far.
Excellent. That is a great thing. Now we have a question from Sonia. Are there specific changes that will impact women in particular? Sonia will take that on notice and add that to our written response out to everyone. We do have a comment here from Phil Dunn at Mind with a very important point. Are there implications for NGOs who work in partnership with clinical services in parks and EIPSRS? That is, for example, joint responsibilities or potentially conflicting obligations. I think that's a really necessary question, Phil. Is there anything else that you'd like to add in expanding on that or contextualising it further? You don't have to, of course, but feel free.
I'm happy to make further comments. I suppose the questions, at the moment, really, there's a deference to the clinical services in terms of any obligations they have around the Act, and the NGO is really supporting that. But I don't know what is in the new Act that potentially creates further complexity around that relationship, particularly if the NGO would take a more well-being, lived experience perspective, no disrespect to the clinical services, of course. So, yeah, just wanting that question posed, really, to consider what the relationship, whether the relationship will change in some way.
Look, Phil, I think that, honestly, that's hitting the nail on the head in terms of a really important point that we want to lead on expanding upon that. I also think that the point you raise has implications beyond just the Act. I think, again, no disrespect to our partners in the clinical space, But classically, the community sector has taken a more wellbeing based approach, and the principles that now apply, universally across the sector aren't going to be news to a lot of community services and NGOs, because those are practices that they'd already internally built into their working style. But there are going to be shifts at that clinical end to reflect the differences and the transition that's happening. There are some other challenges that we're noting as MHV, where, good, worthwhile reforms are being driven by either a perspective at the clinical level or the community level. And what there's a failure to do is marry those two and note that there are services that run across both spaces, such as some of the services provided at Mind Australia. So one of the things that we, and I know our CEO here, Marcel, is really keen to champion is better educating the government, the departments about where those marry up. You can't just take a black and white either or approach, because absolutely, the best outcome is for those services to knit seamlessly together. And we don't want any of the changes to negatively impact services that are already doing that fantastic work. So thank you so much for adding that. And we will have a conversation with the department about that. And that'll be one of the things we return to the group on with some more written detail. Thank you, Kate. You were keen to hear about how the workforce will be supported, in particular GPs. I hope that earlier question went to some of your concern, but we'll put some more of that information into our summary as well. Robin has asked a question about have made a point about there being a lot of discussion about Headspace becoming the youth hubs, but little communication. That is, again, something that we can get some clarity on with the department. I know Taylor might want to share that she's been reaching out and directly engaging with a lot of these national bodies like Headspace so that they can understand their unique obligations and role within Victoria. So Taylor, is there anything else you wanted to add in that regard?
No, well, Headspace, absolutely. But also one of the fantastic things that is coming out of this Royal Commission as well is the child and family mental health and wellbeing hubs. So that's something that we've been getting around quite eagerly as well, to be able to proactively and really have that early intervention support from birth, which is a really groundbreaking thing within Victoria to have. So we're excited and trying to have as much contact with those younger services as well. And they've equally been very responsive and wanting to do their best in this space as a piling initiative.
Fantastic. Now I will just run through a few more. I know we're getting very close to the end of our session and I don't want to hold people who have very busy days ahead, but we've got a question from Semeli about our multicultural backgrounds on the league. And thanks to my colleague Emily, who's passed on my details. Please do reach out, Semeli. We'd love to chat about your engagement there. We've got a question about what Aboriginal community controlled organisations who deliver counselling will need to do to comply with the Act. Another fantastic technical query, and we'll get some information to clarify that and engage with our contacts at BACCHO and other Aboriginal community controlled organisations to make sure that they have the support they need. I'm guessing through VALS to make sure that they're prepared as well. What will be the changes to the mental health services triage function? Practical question, don't know, Graham, but we'll get some info for you if we can. Areas that apply specifically to NGOs from Bronwyn, what it means and looks like to follow the principles if there aren't any specific obligations. Now, Bronwyn, I don't know if you're in a position where you're comfortable to expand on that point, but if you'd like to give us a little bit more colour and movement about what your concern might be there, happy to throw to you for a comment. But if not, we can move.
Yeah, thanks, Emma. It was just a question. Somebody in part of this presentation spoke about that really the expectation is people will adhere to the principles of the Act. And so if there are no specific obligations spelt out in the Act, what does it look like for workforces to adhere to the principles? What will you be seeing?
Yes, and may I ask what organisation you're representing?
CoHealth.
CoHealth, perfect. And CoHealth is one of these tricky ones as well, depending on the services that they're delivering at the time. Organisations that are part of sort of consortiums and are defined as mental health and wellbeing service providers, do have specific and defined obligations under Section 30 of the Mental Health and Wellbeing Act, in that in their annual reporting, they do have to demonstrate how they've adhered to at least one of the principles. Co-health, for the most part, doesn't fall under that definition of provider, other than when they're connected with the mental health and wellbeing locals. So this becomes a little bit difficult again, where there'll be some obligations for part of the organisation, but not as a whole. However, in terms of obligations to the principals, that's probably more so because the principles really do highlight that ultimate goal of doing what's best for the consumer in the long run. So when you break them down, it's all about empowering choice. It's all about optimizing safety, and it's all about doing what's best in terms of their rights. So I dare say there won't be any pushback in people wanting to conform with those principles in the first instance. But yes, in terms of demonstrating their obligation, it is quite difficult and not defined as of yet how NGOs that aren't connected or defined within those service providers, how or whether they do have to demonstrate within annual reporting. So it falls a little bit different. I'm so sorry for your organisation. I don't know whether that helps or hinders.
Amazing. Thank you. Now, I am going to wrap us up. The last couple of comments, we've got Michelle from Golden Valley Health. Have changes to legal forms been finalised? No, I don't believe they have. And a related comment on that is that you might be keen to see regulations, which still need to be gazetted and provided. My advice from the Department of Health is that that is due to happen mid-August. So there'll also be some regulations that supplement what you've seen in the Act. That's relevant. Legal forms, I know, is a big deal for those who are transitioning and probably the front of mind thing. So we will try to get some advice from the Department of Health to better support you in that regard. Everyone else who's put in a question, thank you so much. Genuinely, there are some excellent points of inquiry that have been raised in the chat. And I'm hopeful that there might be other things that come to you as the day progresses. Please do email myself or Taylor. If a colleague could maybe throw our emails back in the chat so that you got them right at the bottom, that would be great. To anyone who was wondering if the recording will be provided, yes, it absolutely will. We're going to round up this event, take the recording offline and make a record of what questions have been asked in the chat or via private message, and then also provide the recording and that summary in due course online on our website. I really can't thank you enough, everyone, for coming and joining us, hearing our presentations, participating in this collaborative session. It really has been a great turnout and we thank you all. We will stay very much in touch. You will see us in your inbox. You'll, see on our website lots of action going on. We want to stay as close to you all as possible. And remember, we are here to support you to do your jobs to the best of your ability. We want to be your partner in that. And if there's anything else that MHV can do to deliver for you, please reach out and let us know. Otherwise, thank you all so much and have a great Thursday.